Hi, Dr. Yass here. I'm here with a client who just finished 30 days of Yass Method treatment, and he's just going to tell us about what his symptoms were, how they were affecting his life, and how things have improved since he performed the exercises. Okay, Rico, take it away.
Yeah, Dr. Yaz. So I'm a 67-year-old, highly active individual. So I lift weights 3 or 4 times a week, and I'm an open water swimmer. I've been swimming in San Francisco Bay for 60 years. So do the math on when I learned to swim, right? So recently, over the past several months, I've had this kind of gnawing gluteal pain after activity that prevents me from sleeping at night without the help of Advil, prevents me from working out the way I want to. It's painful to walk. So we had a session 30 days ago, and you diagnosed the problem as severe pronation. Falling arches, I think, is the term that many people will use. So as a test, you had me work my right side, which is the foot that pronates the most. In fact, that's pronated to the point, doctor, where that big toe angles way over and compresses all the others. And I can't really even walk without any discomfort unless I have orthotics in. Orthotics are a 100% must. Can't leave the house without them. So you worked on a series of movements designed to strengthen those muscles in the foot and in the calf, as well as abduction type exercises to strengthen the hip. And I have to tell you, after 30 days, the results are amazing.
Now, the pain that you were complaining of that was limiting you was in the gluteal region, right?
Correct.
Right. And I think you mentioned that you had sought care and everyone told you that was an SI joint dysfunction issue.
Correct.
But in evaluating you, I established it was actually the piriformis muscle, which happens to pass the SI joint and runs diagonally in the gluteal region to the hip, and that it was straining because the muscle that supports you and keeps you weight bearing directly through the midline of your foot, the gluteus medius muscle, had strained severely. And that was the actual cause of all your symptoms. That's right. What led to you performing the series of exercises I gave you.
Right, exactly. And, just to cut to the chase, after 30 days, I'm pain free on both sides, just from working that one side. So I'm pain free on both sides. My wife and I did an Alaska cruise a couple of weeks ago where we walked for hours every day. And I had absolutely no pain in the foot or the big toe, and no problems sleeping at night.
And one other point I want to make about this, because I want people to understand the relationship of this hip muscle and weight bearing through the foot. You had mentioned that you were getting some sort of callus formation where you needed that constantly being shaven down because of the fact your foot was pronated and you weren't weight bearing properly. And right. Since you've started these exercises, have you required that treatment at the foot?
I have not. The way those 3 toes are bunched, I developed a painful corn that literally has to be shaved down by my podiatrist about every 90 days. So I can actually see the progress of the growth on this, right? On a weekly basis. Since doing these exercises, there's been no growth of that corn for the past 30 days.
So if anybody out there who's having plantar fasciitis or bunions or corns or anything happening at the foot, recognize that the high probability is not that the cause is at the foot, but it's related to the hip muscle strength to keep you weight bearing through the midline of your foot as it was intended to do. That's an important point. And just so that really describes in 30 days a transformation. That sounds pretty amazing. And just one other point I wanted to make is that actually this is the first time that I've worked with Rico. He had a shoulder issue prior, and just briefly tell them what the results of that situation was.
So again, excuse me, as a weightlifter, I developed some chronic pain in my right shoulder, not weeks ago, okay, in my 20s, way back in my 20s when I was playing college football. That right shoulder was always compromised. So on the best day, correct, it didn't hurt that much as on a worse day. I decided to do a session with you. It was about a year ago now, doctor, I think a year and a half ago. And you gave me some band exercises. Not only did it resolve the issue, but my shoulder is better today at 67 than it was at 22.
Awesome. Awesome. And
I'm
again,
doing-
for people to understand, what I did was I just identified the muscular deficits associated with the shoulder dysfunction, which was creating his pain. Not a tear of the rotator cuff, not arthritis, not a labral tear, but the mechanics of the joint were improperly working because the muscles responsible for that weren't strong and balanced. So all we did was reorganize the musculature around the shoulder and shoulder blade. And this guy is telling you now that his shoulder is better than it was in terms of pain and function than it was in his 20s. So people have to recognize that the pain that most people are having is associated with muscular deficits, even when structural abnormalities are identified by X-ray or MRI. The cause is muscular. So with that understanding, if someone has a choice between the standard of care of getting diagnostic testing and being treated based on that versus the Yass method, where you are based, your cause is determined through symptom presentation and if found to be muscular, which it isn't, I've established in more than 98% of cases, doing a few exercises, which would you recommend people choose?
Yeah, I mean, you at least have to give this method a shot. It doesn't cost you any more
There
to
you
try.
go. There you go. All right, man.
Doesn't
Thanks.
cost you-
I
Yeah,
appreciate it, Rico. I really appreciate you coming on and letting people know about your experience. So thanks again.
great talking with you again, Dr. Yass. Take care.
Take care. Bye-bye.